The following is a local resident producer's program. The program content is the sole responsibility of the producer and does not necessarily reflect the views or policies of Oshkosh Media, the City of Oshkosh, or your video service provider.
Hello and welcome to another edition of Making It Happen. This is Edward Castern. Tonight I'm very honored to have my eye doctor, Dr. Dylan Foss from Ascension.
Thanks for having me, Ed.
No problem. And we are going to just, right off the bat, we are going to discuss the eye. So if we can get the graphic up first thing for the eye. Now, there's like the retina, the pupil, different parts of the eye. But the one thing that's the most important is the lens, right? Because isn't that what makes you see your objects? And
yeah, so the lens is a very important part of the eye. It's hard to say what the most important part of it is.
There's so many different parts.
So many different parts. So really, the job of the eye is to focus the light that's coming in at the back of the eye, so that you get a clear image that your brain can then see.
Okay.
So the front part of the eye, the cornea, is very important because it focuses the light. It's sort of like a lens.
Okay.
It has focusing power. And then the lens inside of the eye, which is behind the iris, has a lot of focusing power.
Okay.
And then we have the retina at the back. It's like the film inside the eye that captures the images of what you see.
Yeah. So why were you so fascinated with the eye, and why did you decide to be an eye doctor?
Well, at an early age, I suppose maybe at the beginning of high school, I knew that I wanted to go into medicine of some sort for a couple of reasons. One, I was very interested in science, and two, I was interested in working with people.
Okay.
So it seemed like a natural way to put both of those together would be to go into medicine. But so I went to college. I studied biochemistry and molecular biology at Marquette University. And in my last year of college, I decided that I didn't want to go to medical school to be a regular doctor or a surgeon. I decided I wanted to go into optometry instead and just deal with the eyes. Okay.
And now, if we can put the graphic up again with the eye, if the lens gets damaged, is there any way that, and I know you're not a surgeon, but is there any way you can fix it, or is it non-repairable?
Yeah, so damage to the lens is actually common. All of us, if we live long enough, will get cataracts, which you can think of as damage to the lens. So
what causes a cataract?
So we're not exactly sure what causes the lens inside your eye to become cloudy. There are various theories. The common theory is that it's just exposure to light over the course of your lifetime that will cause most people to get cataracts. However, people can get cataracts for other reasons, like injuries to their eyes. We know that people who have diabetes get cataracts sooner than everyone else. So there can be a number of reasons you could have damage to that lens. Mm-hmm. And yes, you can. Surgeons can go in, take out that lens, and replace it with a plastic implant lens, so that you can see well again.
Okay. And then, now as far as like the other parts of the eye, like the retina, and I know you mentioned this earlier, but what part does the retina play in the eye?
So the retina is, if you think of it as like the film, or nowadays I guess you'd say the megapixel chip at the back of the eye that's capturing the images. And
so it basically stores everything we see?
It's going to send, it's really a sensor that's picking up the image and sending it back along a long pathway from your eye to the back of your head, where you actually see the images.
Uh-huh.
So the eye doesn't really see. The eye is the camera that captures the image, but it's our brain that does the seeing of the image.
And then you've got the pupil too.
Then you've got the pupil, which is that hole in the center of the iris, the colored part of your eye. And the pupil is very important. It may seem like a small thing. It's just a hole there. But it's very important. We know that if you have a large pupil, your vision will be affected by that. Your vision's not as sharp as some may know. If they've had an eye exam and have had their eyes dilated, your vision's often very blurry afterwards. And that's partially due to the large pupil size. Conversely, if you have a very small pupil size, you can have much sharper vision from that.
Why is it so important to dilate the eyes during like the eye exam? Because that's one part that I hate, I must say.
Yes, you're not alone. A lot of patients complain about dilation, but it's very important. The reason it's important is you can look inside of the eye without dilating the pupil, but you really only see about 10% of what's in there. The rest of it you can't see unless you make the pupil bigger. And the analogy I like to use is it's like trying to look inside of a room. If you look through the keyhole, you can see a little bit of what's inside the room, but you'd see a lot more if you open the door and look inside the room. And so when we dilate the pupil, it's like opening the door. You can just see more of what's in there.
And what's the white? You know how I'm looking at you right now, and I see the whiteness. What's that like?
So that's called the sclera.
Okay.
And so that's one of the outer layers of the eye. There's actually a layer on top of that white part of the eye, which is called the conjunctiva. So if you've heard of conjunctivitis, it refers to that clear layer of cells over the white part of the eye.
No, conjunctivitis is not pink eye, is it?
Well,
because you know when I came in for my exam, I told you I was having trouble with the crusty stuff, around my eye, and Dr. Kramer said that was conjunctivitis, and he's like, and then Rachel said that was pink eye. But I'm like, I just want to clear up the two.
Yeah. So they can both be used. Conjunctivitis and pink eye can both be used in a sort of general way to say you have an eye that's pink.
Okay.
But most of the time, what we mean by pink eye is a viral conjunctivitis caused by a virus. Whereas a conjunctivitis to an eye doctor could be bacterial, it could be allergic, it could be viral. So
it can basically just be that you have allergies.
Correct. That would be allergic conjunctivitis.
Yeah, okay.
Yeah.
And is pink eye pretty common?
Very.
Very?
Very, very common. Let's talk about pink eye for a moment because
okay.
It's a common thing and many people get it. It is, once again, just a cold in the eye. It's a virus in the eye. Okay. And so it tends to be self-limiting. By that I mean you get it and maybe 10 to 14 days later, if you do nothing at all, it will go away on its own.
Whoa.
But it's very, very resilient. The best research on the virus that causes pink eye is that it can survive on doorknobs, on surfaces of tables for months. So it's a really, really common, resilient virus that's out there a lot.
And so, but we don't know what causes it.
Yeah, so usually you touch the virus on a surface of something, a door, or let's say a doorknob, and then you rub your eye.
Yeah.
And that exposes your eye.
So that's why it's so important to wash your hands often too.
Yeah, exactly.
So. Yep. And then with pink eye too, doesn't it get real itchy or am I thinking of something else?
Yeah, with pink eye, the thing that most people complain of is itching, foreign body sensation. By that we mean it feels like there's something in your eye, such as an eyelash. It's scratchy. The eye gets red, but usually not really bright, deep red. It's more of a pink color, and it gets weepy.
And sometimes you have a hard time opening that eye, right?
Yes, you can often have crusting in the morning from it.
Okay, I'll wake up and I'll get that crusting, but do you think that's just from allergies, or is that? And then I'll have to wipe it out every morning or so.
Yeah, so once again, a very common complaint that people have. Yeah, it can be allergies. It could also be dryness during the night. Your eye will react to dryness on the surface of the eye.
Well, my apartment's very dry, so...
Yeah, and if you sleep with a fan on whether it's
I
a
do.
ceiling fan.
I do.
That'll increase the dryness as well.
Okay. And then, what should a person do to take? I mean, what can a person do to take care of their eye?
Yeah. So you want to make sure you have eye exams every year. This is the best thing you can do. Now, many people out there may say, "Well, my vision's great. I can see what I need to see. Why would I need an eye exam?"
Yeah.
And of course, being an eye doctor.
Do you recommend every year?
Every year. Because
I think when I went, I hadn't been in there since, 2013?
Could be. I don't remember the specifics.
I think you said 13. I'm like, had it really been that long?
Yeah. Time flies. But unfortunately, we do see, during the course of routine eye exams, serious eye diseases that people don't have symptoms for. So as eye doctors, we're concerned about that.
Do we want to talk about some of those most common diseases?
Certainly. So common eye diseases that we see. We see lots and lots of people with diabetes. We know that there are more and more people in our country each year with diabetes. Diabetes causes eye problems that are preventable. So the most common is diabetic retinopathy.
That's what I was just going to ask you. Can the eye get can you get diabetes of the eye?
You can.
Okay.
You can. So diabetes is going to affect your whole body, and what it does is it causes the small blood vessels in your body to become leaky.
Okay.
And so they will leak blood and they leak fluid. And this is going on in your whole body, but the eye gives us a unique opportunity to look inside your body and see those small blood vessels. So we can see that with our microscope inside the eye, and it's called diabetic retinopathy. And it has sort of a range. It can go from very mild to very severe. And as you get to more severe, your chances, your likelihood of permanent vision loss go up. So it's very common. It's one of the leading causes of blindness in our country.
What can you do what can somebody do to treat that?
So,
or if you can catch it early enough.
Correct. So it's a couple of things factor into this. One is your blood sugar control. You want to make sure that you're working with your regular doctor to control your blood sugar and keeping it where it needs to be, not too high, not too low.
Okay.
And there's a blood test that they do, which is called a hemoglobin A1C, and that tests your blood sugar over the course of about 3 months.
Okay.
And that is a very good indicator of how your eyes will be affected by diabetes. So we like to see, in general, that number 7 or under. So that's the first thing, keeping good blood sugar control.
Okay.
The second thing, regular eye exams, every year at least.
Okay.
But for our patients who are starting to develop the signs of diabetic retinopathy, then we want to follow them more closely because we want to see if they're going to go from what we call non-proliferative diabetic retinopathy, where you just have leaky blood vessels, to something called proliferative diabetic retinopathy, where new blood vessels start to grow inside the eye. So your body's pretty good at trying to fix itself. And when it recognizes that you have these leaky blood vessels, it wants to build a bridge around the leak. So it starts building a new blood vessel around the leak, and we do not want new blood vessels in the eye.
So the eye tries to do it like a Band-Aid kind of thing.
Yeah, it tries to divert the blood flow around the leak, and that can lead to a host of problems in the eye that lead to blindness.
Okay. Because you want to try to treat that leaky blood vessel.
Right. So we don't want it to get to the point where your body's making these new blood vessels. So we watch it more carefully when we're getting close to that point.
Okay.
And then if you do get to that point, then I'm an optometrist. We send you out to a different doctor, a retinal specialist, who have different ways of treating that and getting those new blood vessels to stop growing and then to regress or shrink.
Yeah. Now, how fast does it take? I know that the eye is the fastest healing muscle in the body. I think that's true.
The outer surface of the eye is the fastest surface of the body that will heal.
How long does it take for it to heal?
Well, most injuries to the surface of the eye, about 12 to 24 hours.
Okay.
If it's just, let's say, an abrasion or a cut
Or let's say you scratched yourself.
Yeah, if you scratch yourself, 12 to 24 hours, usually. The problem is sometimes it takes longer because you're blinking a lot, and the cells that are healing on the surface of the eye can be dislodged as you blink.
Uh-huh.
So it doesn't always work that way, 12 to 24 hours, doing nothing at all, but it can heal that quickly.
Okay. What's another common eye disease?
Okay, so we talked about diabetes. Second most common eye disease, of course, would be cataracts. Maybe we could even say that's the most common.
Okay.
Everybody, as I said earlier, everybody, you live long enough, you're going to get cataracts. So once again, this is when the lens that's in your eye becomes cloudy, typically with age. However, it could be due to an injury or some other factor. And the symptoms of cataracts would be blur, decrease in vision, and glare. Usually it's glare from headlights at night. Many people complain of halos or starburst patterns from headlights from oncoming traffic. Very, very common with cataracts. Treatment for cataracts is to remove them when they start to affect your vision, when they're bothering you.
Okay.
And once again,
would you recommend to get them done earlier than later? Because some people wait to get them done.
Yeah, so the old way, the old paradigm for treating cataracts was to wait until they were ripe, what we called ripe. And you'd wait till they got to a certain point and then remove them. But today, cataract surgery is so much safer, and the calculations for this procedure are so much more accurate that you really can have it done sooner rather than later. And there's an advantage to having it done sooner in that the lens that has the cataract in it is more pliable, it's softer, and it's easier for the surgeon to get out when it's earlier in the process. As it gets older, as the cataract becomes more ripe, it actually becomes harder and it takes more effort to get it out. And so you have a little bit more time healing from the surgery.
Okay. And how long does it, let's see now, how long does it take for, forgot what I was going to ask here, but how long does it take for the eye to heal after a surgery?
Yeah, so for cataract surgery, it usually takes about 3 weeks. However, your eye heals maybe by a week and a half. Most of the healing is done. But there's still some internal healing that has to take place. There's an implant that's put inside your eye during cataract surgery. It's a very small plastic implant. And it has to scar into position so that it doesn't move too much inside of your eye. Believe it or not, these implant lenses have if they move a very small amount, a millimeter or less, it can affect your vision a lot.
It'll throw it off, right?
Yeah, correct. So we want that to scar into position so it doesn't move too much inside your eye. And that takes about 3 weeks.
Okay, so if that even moves just a little bit, so does that form as being part of the eye? Because I imagine that the eye is not used to having a foreign object in there, right?
Correct. So the good news is this lens that they put in your eye is made of a very inert material. So it's made out of some type of a silicone blend that does not react at all with your body. So your body doesn't even know it's in there.
It just kind of forms with the eye, and it's part of you, kind of.
Correct.
Okay? So, how can people take care of their eye as eye care?
Yeah. So we again, regular routine eye care is the best way to do this. So yearly eye exams. However, good diet makes a difference as well. The old wives' tale about eating your veggies really is true. Maybe not so much carrots, but the green leafy vegetables are really good for our eyes. Kale, spinach, broccoli. And fish. Fish is very good for the eyes.
Any type of fish?
I suppose any type of fish. Maybe you could say certain types of fish have higher contents of omega-3 fatty acids, which are an important part of our tear film. So maybe, let's say salmon would be better than shrimp.
Okay.
But in general, fish are good.
Now, like, when you go through an eye exam, what are you looking for?
So eye exams really are broken up into two basic parts. The first part is your vision, what's your vision like, and then the second part is what your eye health is like.
Okay.
So we look for lots of things during the course of an eye exam. But let's take that first part. Check your vision. What is your vision like? So, of course, most people are familiar with the eye chart. Cover your eye, read to the bottom line. And what we're doing there is we're having you look at letters that are of a very specific size. And so they take up a certain space at the back of your eye when you're looking at them. And the type of letters we use in this country are based on the 20-foot testing distance. So, for instance, you've heard of 20/20.
Yeah.
20/20 means you can see at 20 feet what somebody with normal vision
Yeah.
could also see at 20 feet. But let's say you have decreased vision and you have 20/40 vision.
Yeah.
So that means you can see at 20 feet. What someone with normal vision could see back at 40 feet away.
Okay. So you're basically just looking at eye health and health of the eye. Have you ever had somebody come in, and this question just came to me as we were talking, they may be 30 years old, but their eye looks like it's 60 or older.
Yes.
You know.
It happens, yes, unfortunately, for various reasons. Sometimes it's an injury. Sometimes it's their overall health.
Okay.
For instance, typically diabetes,
Okay.
high blood pressure. Sometimes it's cancer. We've certainly had patients over the years where they've come in for routine eye exams and have had problems in the back of their eyes, and it's turned out to be lymphoma or some other type of cancer that's affecting the rest of their body, and it was discovered during the course of an eye
Now,
exam.
if a person has cancer or lymphoma, can they still get chemo and treat the eye? You know,
Usually in those cases where the cancer is not in the eye itself,
Okay.
then the treatment of the whole body will clear up the problems inside the eye.
Okay.
Yeah. But if the cancer is inside the eye itself, and yes, you can get cancer inside the eye, then typically you have to treat the eye itself to get rid of it.
At what point, like, let's say something got so bad that you had to get rid of the eye, if the cancer was just consuming it, then you have to
Correct.
pretty much get rid of it?
Correct. And so there are a number of reasons for this. In the very young, there's a tumor called rhabdomyosarcoma,
Okay.
and which is a common reason for losing the eye, or what we call enucleating it, removing it. For adults, it's usually melanoma in the eye. So just like you can get melanoma, some are familiar with the skin cancer melanoma. You can get the same thing inside the eye.
What causes melanoma of the eye?
So it's the pigmented cells inside of your eye just turn into this very aggressive cancer. So just like you have pigment in your skin, you have the same type of pigment inside the eye, and so it's susceptible to changes from sunlight, and so you can develop a tumor in the eye.
Is too much sunlight not good for the eye?
Good question. Yes, more and more research is showing that we should be protecting our eyes from the sun with UV protection and sunglasses when we're out in the sun. And especially here in Wisconsin, I have to put in my plug. It's just a personal pet theory, but it's especially during the winter. We should be wearing sunglasses. Sometimes we think you wear sunglasses in the summer because it's cool and you look good.
Yeah.
But in the winter, there's probably more sunlight around on the surface of the earth with the snow bouncing around and cloud cover.
People like, oh, it's sunny outside. But I'm like, it's sunny. That means the sunnier it is, the colder it is.
Yeah, that's right. That's right. And when it's sunny and there aren't a lot of clouds, the light bounces off the earth and goes back into the atmosphere. But when it's cloudy, the light comes through the cloud and bounces around. You've just got more light around. So be sure to wear sunglasses in the winter as well as the summer.
So, like me, I know I'm susceptible to bright light. I've been to many eye exams with you, and my eyes don't like bright light. Are some people more acceptable to light than others? Like,
definitely, yes. In general, it depends on how much pigment you have inside your eye. So usually people who have blue eyes are more sensitive to light than people who have brown eyes, in general.
Okay.
There are always exceptions to that. But it seems the more pigment you have in your eye, and that's really, you can tell that by the color of your iris.
Okay.
Are you blue-eyed? You don't have a lot of pigment inside your eye, or are you brown-eyed? You have a lot of pigment inside your eye. That will kind of tell you if you're.
And how come after you cry sometimes? And I don't know. Maybe you can answer this. After you cry, sometimes you'll get like your eyes will keep blinking like this, and you can't get it to stop after crying.
Yeah.
Why is that?
Well, when we cry, we have so let's talk about the tear film for a moment. And I think this will make it a little easier to understand. Our eyes produce two different types of tears. So there are what are called goblet cells, these little cells in our eyelids that ooze tears out of them all day long.
Okay.
And those tears are a thicker type of tear, coats the surface of the eye and keeps it from drying out.
Okay.
And then we have a large gland up above our eye which produces a watery, loose type of tear that flushes the surface of the eye. So it's when we cry, when we're emotional, or we have something in our eye and it's irritating our eye, this gland up above our eye produces this very watery tear that flushes the surface of the eye, which is good. We want to flush the surface of the eye.
It'll also drive you crazy because like you just wanted to stop blinking.
Right. So that tear will disrupt the first thick type of tear, and it takes a little while for that balance to come back after you've had a really watery, loose tear in your eye. So that's why you're blinking and trying to get that tear film to go back to its equilibrium.
And then, how is eye color determined? Is it determined between both parents? How is it determined?
Yeah, so that's a great question. So the best research now shows that there are probably about 16 different genes that determine our eye color. But
fascinating.
Yeah, there are a lot of them, but there are two major genes that do this, and yes, they come from mom and dad, and so you can see it's somewhat complicated, but there are very good charts on the internet. You can Google that to see how it works. But in general, eye color is determined by one color. So everyone basically has brown eyes. That's overly simplistic, but there's only one pigment. It's brown. So depending on how much brown pigment you have in your eye, you'll either have very brown eyes, if you have a lot of brown pigment, or if you have no brown pigment, it would be your eyes would look red. So if you've seen people with albinism, or even, let's say, a rabbit with albinism, the white rabbit with the red eyes, no pigment in the eye. But let's say someone who has blue eyes, you have just a little bit.
I have blue eyes.
Yeah, so you have just a little bit of brown pigment in there. And then for those of us who have hazel eyes, I have hazel eyes, it's even more brown pigment, but not enough to make it look completely brown. So it's really just a matter of how much brown pigment you have, whether your eyes are going to be blue, green, grayish.
It really does come down to 16 different genes.
Yeah.
Well, Dr. Foss, thank you for joining me today, and this is Edward Kasten for Making It Happen. Thank you.
Thank you, Ed.